Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Frank Zhou. He is a medical student. He wrote the KevinMD article, "Is Descovy really the better option?" Frank, welcome to the show.
Thanks so much for having me, Kevin.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. I grew up in New Zealand, and then I came to the States when I was 18 to do my undergraduate education. Did my bachelor's in chemistry at Harvard, stayed in Boston for 3 more years to do healthcare consulting, where we worked with clients, making drugs, devices, diagnostics. And I just moved to LA 5 months ago to start medical school at UCLA.
So you were a healthcare consultant after undergrad for 3 years. What made you decide to step back into the classroom to medical school?
I've always been really interested in healthcare and the idea of, improving the lives of people through medicine and health innovations. I think ultimately at a certain point, I just really missed that patient interaction. I wanted to have more of a direct impact on patients. I thought that my work was sort of helping companies make products to help patients, but I really wanted to sort of have more direct impact.
So a lot of medical students, they go straight through undergrad, through medical school. You have the benefit of some real world experience. Can you comment on how that makes a difference in terms of the beginning of your medical education?
Oh, I think it's been so valuable for me having those 3 years out of school. I mean, I just feel like I have a lot more real world experience in how the healthcare industry and how health systems work. I can really come to medical school with a really better perspective on the various stakeholders that are involved in making healthcare and delivering these services that we as clinicians will rely on and hopefully have these innovations for our patients in the future as well. But also to understand, like how drug companies work, how drug development works, and how insurance and all of these different things that are so important to clinicians, but aren't taught particularly comprehensively in medical school.
What are some things about how drugs are developed and how drug companies work that you've learned that may not be immediately apparent to some of your other medical students who did not have this type of experience?
Oh, I mean, it's a very complicated process. First of all, you really got to understand the amount of resources that are poured into drug development and the amount of failures that are along the way. But then, you also sort of realize some of the things that go on in terms of pricing and making sure that a drug is covered by insurance and the different tips and tricks that companies play to get things covered, but then also the things that insurers try to do to make sure that they limit costs. And I think that really just gets you a better perspective as a medical student to understand, okay, where are the drug companies coming from? Where are the insurance companies coming from? How does policy maybe play into this? And how do you design policy that, understands that each stakeholder has their own issues and motivations? I think that as a medical student, if you don't understand this, you might only say, well, drug corporations are bad or whatever, you may come to it with a very naive view. But I think I do have more of a nuanced understanding of how all of these different stakeholders come together to form our healthcare ecosystem, which of course is no way perfect. And I do have, my own biases and interests as a future provider, but I do think I at least can see more perspectives than maybe a typical medical student who didn't have this real world experience.
All right, let's transition now into your KevinMD article that you wrote. It's titled, "Is Descovy really the better option?" Descovy is HIV pre-exposure prophylaxis, one of 2 options, with Truvada being the other one. Now, just to get all my listeners up to speed, can you give us some context and tell us what HIV pre-exposure prophylaxis is?
Of course. So Truvada has been the main drug that's been used for HIV pre-exposure prophylaxis for a while now, and it's a pretty amazing drug. Basically, it's a once a daily pill that you take if you're at heightened risk of contracting HIV, and it's really, really effective. I mean, if you take it as prescribed, your chances of getting HIV drop by 99% or more. So it's really, really effective at preventing HIV. It's made by a company called Gilead, and they've recently, in the last couple of years, launched a new drug called Descovy. I think that's what my article is talking about, is whether this new drug, Descovy, is it worth it from a healthcare system perspective? What are the benefits and disadvantages of using this drug compared to the original one, Truvada? And it's complicated by the fact that Truvada is now a generic drug, whereas Descovy is still a branded product.
All right, let's go into more details. Tell us about some of the pros and cons, and from a patient standpoint, what are some of the decision-making process that will go into choosing one treatment over the other?
So I was really interested in this from the patient perspective as well. And so I did a sort of informal Instagram poll where I basically asked, all of my followers who are on either of these medications to let me know why they chose one drug over the other. And I was interested to see that a lot of people have switched to Descovy. About 30% of my Instagram followers were on Descovy rather than Truvada, either mostly the generic Truvada. And their reasons for going on Descovy were pretty varied. A lot of them thought that it had fewer side effects than Truvada. They thought that their physician had recommended it to them because apparently it was better for theoretically the kidneys or the liver or something that they'd heard. And then for others, they sort of liked the idea of a smaller pill, or maybe they didn't really think about it much and they just assumed it would be more effective.
So in terms of some of the research behind these two medications, so how valid are some of the reasons patients chose Descovy over Truvada? Does Descovy have a better side effect profile than Truvada?
So I think that's how Gilead will market it to physicians, is that Descovy is better. But when I really looked into the studies and the clinical trials for Truvada and Descovy, it's not so clear. I will say that, and I like to characterize it as Descovy has a different side effect profile to Truvada. And so we do see that in the head-to-head trial between Descovy and Truvada, that there were a couple of sort of indicators of bone health or kidney health that were in favor of Descovy. So a slightly higher and significantly higher glomerular filtration rate and change in bone mineral density. But when you talk to the experts, they aren't sure that these significantly higher numbers really actually translate to clinical differences, because statistically significant doesn't always mean clinically significant. And then in the same analysis, you don't actually see significantly more bone fractures when people are on Truvada versus Descovy. So, is the bone health thing really warranted? Is that really a significant improvement when you use Descovy? It's not so clear. And then Descovy has a few other drawbacks compared to Truvada as well. It has been associated with weight gain and increased cholesterol. And so, it's just, I think, different side effects. You just have to look at it from individual perspectives. And then maybe if you have some kidney, risk of kidney disease or heightened kidney issues pre-existing, then maybe you don't go on Descovy. But I would characterize it as not one drug is better than the other, but they just have slightly different side effect profiles. And I mean, the efficacy is equivalent. And so I think there really is not a huge swing in favor of Descovy.
And what is the cost difference between Truvada and Descovy?
Well, it's hard to say these things exactly because everyone likes to keep prices pretty under wraps. But, as far as I can tell, generic Truvada, you can get that for less than $50 a month. And the list price for Descovy is, $1,900 a month. And that's not the exact price that insurers will pay, but it does highlight the staggering amount of difference that there is.
So if a patient was prescribed Descovy by their clinical team, should they inquire about Truvada if the efficacy is similar and the side effect profiles is not appreciably worse, but there's a significant cost difference? Is this something that they should ask their clinical team about?
I would say that it would be prudent to ask. I think from an individual patient perspective, I don't fault them if they just go with whatever drug is recommended to them. And the reason I say they should ask is more from health system perspective, let's say, to try and save overall costs when, the two drugs are so similar. Because as we know, excess spending is never warranted unless there's actually clinical benefit. It raises prices of insurance premiums up for everyone. And so why not save costs when the drugs are so similar? But as an individual patient, you're not really thinking about these things. You're just thinking about, do I have a drug to use right now? They're both basically the same. I don't see any cost difference probably because my insurance covers it. And then, you might not be tempted to ask, but I would say to patients, do have the conversation with your physicians and think about, whether generic Truvada is basically good enough and just as efficacious for you, and why not stick to that?
We're talking to Frank Zhou. He's a medical student. He wrote the KevinMD article, Is Descovy Really the Better Option? Frank, in your informal Instagram poll in the comment section, in general, what's the sentiment of your followers when it comes to Truvada versus Descovy? Do they have a preference for one over the other, taking into account the cost difference?
I think some people really did believe that the side effects were hugely in favor of Descovy, maybe through marketing or what their physicians had told them. And then, when I did try to explain some of the research that I did, they were pretty convinced or wanted to take a second look. Most surprising was I actually had a lot of friends who already had the same viewpoint as me, and they had talked to their doctors or done a bit of extra research themselves and come to the same conclusion, thinking that why would they go on Descovy when it's basically the same drug as far as they could tell? So I had a lot of support from my Instagram followers to my article as well.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
I think as a physician, I've been thinking that there's so many new drugs that come out, and it's hard to do the full diligence of your research on every new drug. And so you do rely a lot on marketing and sales reps and companies coming to you with proposals. So I don't really fault doctors for, just pushing Descovy if they think it's a newer and better drug. But, I think it's good ultimately. And this is something I'll hope to remember in the future, is just do a bit of extra diligence on every new drug that comes out. Maybe don't buy the hype immediately, and think about, sometimes how you can save costs for the system, because, healthcare costs are so high in the US right now. Every little bit does matter.
Frank, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks for having me, Kevin.